Thank you for allowing me to present our research today. My name is Becca Deal. I'm a general surgery resident at Rush University in Chicago, and I'm going to be presenting our study called Understanding Intestinal Glucose Transporter Expression in Obese Compared to Non-Obese Subjects. Our group has no disclosures. So what do we know about bariatric surgery? We know that bariatric surgery is a well-established treatment for obesity and obesity-related comorbidities. We know gastric bypass is superior to the best available medical treatment for type 2 diabetes, as demonstrated in multiple randomized controlled trials. And we know that many patients with diabetes experience improvement in their insulin sensitivity in just a few days after bypass before any appreciable weight loss occurs. Despite advances in research, there is much we don't know regarding the mechanisms of obesity and bariatric surgery. We don't thoroughly understand why bariatric surgery works, nor do we completely understand how gastric bypass causes remission of obesity-related diabetes. One theory is that the cells of the intestines undergo a change in cellular expression following bypass. While there have been several rodent models that demonstrate this intestinal remodeling, there are few human studies to date that have demonstrated these changes. One interesting finding recently published was the change in glucose transporter expression after Roux gastric bypass. So glucose transporters, also known as GLUTs, refer to a wide group of glucose and fructose transporters that facilitate diffusion across the membrane. While GLUTs are expressed in several different tissue types, the most abundant source for these transporters is within the intestine. A study published in Science by Saidi et al. From 2013 demonstrated in a rodent model the morphological adaptation of jejunal GLUT1 following Roux gastric bypass in obese diabetic rats. GLUT1 is found predominantly in fetal intestines, where it's thought to play a role in early intestinal growth. However, by adulthood, GLUT1 receptors have diminished to barely detectable levels. Interestingly, GLUT1 was found to be upregulated in the roux limb of rats after their gastric bypass, and this was associated with an improvement in their glucose metabolism. While multiple GLUT family receptors have been identified in humans, there remains a limited understanding of the variations in expression. Additionally, there have been no studies to date comparing the differences in expression of GLUT receptors between patients with obesity and those without. Our question was, what is the difference in the expression of various GLUTs in subjects with obesity compared to those without obesity? We conducted a prospective cohort study of jejunal tissue obtained from two groups, subjects with obesity and control subjects without. We had a total of 19 patients in our obesity group. Specimens from subjects with obesity came from consenting adults who met NIH criteria for bariatric surgery and underwent a laparoscopic Roux gastric bypass at our institution. The specimens were obtained from the stapled jejunal anastomosis during the bypass. We had a total of 6 subjects in our control group. The controlled jejunal specimens were obtained during intra-abdominal organ procurement procedures from non-obese and non-diabetic organ donors after brain death, who were not eligible for bowel transplantation. These specimens were approximately 50 meters from the ligament of Treitz, and we evaluated the expression of GLUT1, 2, 4, 5, 7, and 9 using Western blotting and quantitative real-time PCR. In terms of demographics, we found no statistical differences in age, gender, ethnicity, or hemoglobin A1C levels. And as expected, we did find a significant difference between our two groups regarding their preoperative weight and BMI. So no GLUT1 or GLUT7 proteins were identified in the jejunum from either group. Here you can see our Western blot for GLUT1 on the screen. The absence of these proteins is consistent with the literature. As I mentioned previously, GLUT1 is almost exclusively found in fetal intestines and is not expressed in adults. GLUT7 is predominantly found in the liver, which explains why it is absent in both of our specimen groups. We found GLUT2, 4, and 9 to be expressed in the jejunum from both the obese and non-obese groups. We found that there was no significant difference in their expression between either groups. And this was demonstrated, you can see in our Western blots, and then graphically on the bottom that we had no statistical difference in these 3 transporters. We were, however, able to find a difference in the expression of one specific glucose transporter type. In our study, we found a decreased expression of GLUT5 in the jejunum from obese subjects compared to our control. On the top of this slide, you can see our Western blot series, and below we demonstrate graphically the difference in protein expression. Here we can see the confirmatory mRNA expression of the different GLUT proteins. Again, GLUT5 expression demonstrates the only statistical difference amongst obese versus non-obese specimens. GLUT5 is a fructose transporter which regulates the absorption of fructose from dietary substances within the intestine. While it's established that fructose involved in the development of obesity and obesity-related diseases has been shown, the role of GLUT5 is less clear. Our study demonstrated a decreased level of GLUT5 expression from the genome from our obese population. Interestingly, several studies have shown that GLUT5 expression is decreased in states of inflammation. We know there's an association between obesity and chronic inflammation in the absence of infection or other inflammatory diseases. While our study is a comparison between GLUT transport expression and obese versus non-obese individuals and does not confer the cause of GLUT5 expression difference, the chronic inflammatory state in individuals with obesity could be one possible explanation for our findings. We also established the first GLUT panel comparison in humans between obese versus non-obese subjects. Our hope is that this can be used in the future to demonstrate the intestinal remodeling that may occur after gastric bypass, as well as the impact GLUTs may have on glucose homeostasis. We had several limitations to our study. First, well, we had a lot of limitations. We had a very small N for both groups, and fundamentally, our donor group, since these were sick patients who were deceased due to brain death and probably in an ICU, you know, we assume that there could have very well been a difference just from that alone. For looking towards the future, we hope to continue our work developing a comprehensive panel for GLUT transporters in obese versus non-obese. We feel that future prospective studies should also evaluate the timing of GLUT expression and how it correlates to the improvement in type 2 diabetes. Thank you.
Thank you, and we'll take any questions from the floor. Just a reminder to come to the mics and introduce yourself.
Hi, Mike Wood, Dartmouth Hitchcock. You know, I was wondering, do you believe that what you're finding here is a purely, genetic phenomenon, or do you find that this is more an adaptive response to sort of an overfed state in these individuals?
Yeah, that's a really good question. We're not sure yet. We're sort of just kind of figuring this out, that maybe there is a difference. Other literature that I've read about in terms of these transporters, it can vary quite widely just based on your diet. So it's hard to discern, what came first for these patients.
I have a question for you. It would be nice to be able to see what happens to the GLUT5 receptor down the road as the patients lose weight, but you're obtaining your specimens from surgical resection, which makes it impractical. Can you get enough tissue from endoscopic biopsies to be able to assess GLUT5?
Yes, and we're planning on doing that in our next study.
Any other questions from the floor? Thank you very much.
Thank you.